Good evening, everyone. It is my pleasure to see you all gathered here today for our panel. We gear up to tackle the issue of global governance. This topic is all the more captivating in the context of the COVID-19 pandemic, which has forced us to reconsider our own individual relationship to both now concept and to everything we had previously thought normal or commonplace. I am pleased to have alongside me a number of friends and collaborators, the Institute for Advanced Study in Levant Culture and Civilization for this panel. And I extend a warm thank you and hello to Professor Jeffrey Sachs at Columbia University, Director of the United Nations Center for Sustainable Development. We're waiting for him. Professor Luisa Spiru of the Carol Davila University of Medicine and Pharmacy in Bucharest, President of the Ana Aslan International Foundation. Dr. Ismail Seradelgin, co-chair of the Nizami Ganjab International Center, a fellow of the World Academy of Art of Science, and former vice president of the World Bank between 1992 and 2000. Professor Remus Pricopie, rector of the National University of Political Studies and Public Administration in Bucharest, and fellow of the World Academy of Art of Science. Professor Laszlo Borbeli, of the Babeș-Bolyai University of Cluj-Napoca, State Counselor for the Department for Sustainable Development of the Romanian government, and President of 19th session of United Nations Commission for Sustainable Development between 2010 and 2011. I would also like to introduce Dr. Oana Brânda of the Titu Maiorescu University of Bucharest, expert of the Institute for Advanced Study in Levant Culture and Civilization, manager of the World Post-COVID-19 Pandemic, a humanist vision for sustainable development project and co-moderator of this panel. I also welcome Gary Jacobs, who is with us. Dear friends, over the following 2 hours, I would cordially invite you to an open discussion on how we can create an efficient and effective strategy for global governments by tackling several essential sectors: health, education, sustainable development, economics, etc. Since the panel will take the form of an extensive question and answer session, I would kindly ask that you limit your replies to short 3 to 4 minute intervals, that we might cover as much ground and as many examples of good practices as possible. To begin with, I think it is fair to say that the COVID-19 pandemic has sent a number of alarm bells ringing. Issues such as health, societal imbalances and their associated inequalities, equitable access to resources, all of this covered by the United Nations Sustainable Development Goals, have worsened following the pandemic. And given that this panel shall focus on the role of academia in elaborating a vision of a strategy for global governance in the 21st century, I believe that the main goal of our debate is to achieve a better understanding of this concept, which has been given very vague definition so far. Therefore, I believe it is essential that we seek a definition from the very beginning of our discussion. And Now, my first question is for Dr. Ismail Seraderjin. Global governance cannot be achieved without intense cooperation between all sectors of society. Dr. Ismail Seraderjin, does the academic environment have something to contribute to the design and development of governance in the 21st century? Or something dominated by politicians and power politics between nations?
Well, thank you, Mr. President. You yourself are a magnificent example of a leading academic who also is a political leader and a thought leader in the world. But it was long said by the great John Maynard Keynes himself, the practical men who believe themselves to be quite exempt from any intellectual influence are usually the slaves of some defunct economist. And I think there's a lot of truth in that. What we call practical wisdom and common sense is usually the result of what was thought and developed in the various academic institutions around the world. What is very clear right now is that we are running out of steam on the model that has dominated the world since the end of the Second World War. The idea of the structured United Nations, but dominated by a group that have veto power on the Security Council. The idea of, yes, multilateralism, but also a hegemonic power. And we went through the difficult period of the Cold War, and where many of the countries tried to develop techniques so that they didn't have to choose between the Soviet Union and the United States and the West. So we are now reaching a stage where it is clear that the old alliances of 75 years ago are in movement, and where China is rising, where there will be a multilateral world of a new order done. But there's also a backlash of nationalism. And who else other than the intellectuals who are housed in academia most of the time can challenge that and reassert our common humanity? We had gone a long way by 2015, but we are witnessing a return of populism and nationalism. We are witnessing a disengagement even from the WHO in the middle of a pandemic. And therefore, I think we need to reassert the principles that gave us the Sustainable Development Goals, that gave us the Paris Accords, that gave us a belief in the fundamental human rights, and to design new instruments, especially on the economic side, which I can talk more about, because many of the poorest countries are going to have a huge setback as a result of the COVID-19.
Thank you.
Thank you, Ismail. On the topic of sustainable development, I would like to point out that Mr. Laszlo Borbély is currently a state councillor for the Sustainable Development Department within the Romanian government. Mr. Borbély, could you tell us how decision-making factors can constitute a catalyst for sustainable development? What has been done until now at the state level to achieve the United Nations Sustainable Development Goals?
Good evening, and thank you very much for inviting me to this very important panel, and I am honored to be here. As I suppose I am the only representative of the state in this moment, in this panel. I had the chance to chair the last CSD19 on the level of United Nations between 20 2010 and 2011. And I realized at that time how important are the two important pillars of the development. One, science and all this part of academic area. And second, the political willingness. Because on that time, it was 5 very important and technical declarations prepared by 2 years by brilliant technicians regarding chemicals, regarding waste management, regarding mining, regarding sustainable transport, regarding consumption and production, sustainable consumption and production. And in one day, because of political debates, Osama bin Laden was killed just by this period. Between G77, United States and Israel, in one day, they reject all 5 declarations. So we cannot go forward without a leadership which is a positive, which has a positive approach regarding these principles, and of course the science and the know-how of those who are working on this. And in 2016, I succeeded to pass to the Romanian parliament without any vote against or abstention, a very important political declaration regarding the implementation of Agenda 2030. After that, we implement, first of all, we established a department near the Prime Minister's office. It's very important to have a coordination office. Those who are capable to offer for the politicians the preparation of decisions, economic, social, and environmental. Step by step, we finalized a new strategy for Romania in sustainable development. We established an interministerial committee, which will have, I hope, in a couple of days, the second meeting, which all the ministers are there, and the Prime Minister is the president of this body. Why it's important on this very tough period of COVID-19? And in my opinion, we have no, as soon as possible, a post-COVID-19 era. We will have a COVID era, unfortunately, because it will not disappear. We have to live with this, but we have to prepare ourselves physically, of course, regarding our health, our physical, mental system, how we approach on this to have a normal life and to prepare our economies. And that's why now, not just on the level of European Union, but we are speaking about global governance. Everybody has to understand that we need more action for circular economy, more action to transform all the decisions in a neutral carbon world. And that's why it's Green Deal very important to implement on the level of European Union a new approach of the European semester, and parallelly to have a very tough dialogue with academic area. And that's why I am very pleased that we have here those who are involved in academic area, because we had 2 very important meetings with all universities. We have now a map of how in universities they are teaching Sustainable Development Agenda 2030, holistically speaking. And we have to work together. We will have a consultative council near the government, 34 very well prepared people, personalities from different areas. So we have to put together leadership, political willingness, very well prepared scientists, and all stakeholders to have their input in creating, based on these basic principles of ethical and other very well-known basic principles of a society, how we can put together a better world. But it's very difficult when we are seeing how there are very, very important movements on the world. We have autocratic leaders, we have some very negative approach on this field. So we are prepared. Romania is a regional hub in this moment regarding sustainable development, but now will be the big challenge for us, for the politicians, to put in place what we have, holistically speaking, in our mind. Thank you.
Thank you, Dr. Borbély, for bringing up global governance. And given that this panel shall focus on the role of academia in elaborating a vision and strategy for global governance in the 21st century, I believe that the main goal of our debate is to achieve a better understanding of this concept, which have been given very vague definition so far. Mm-hmm. The pandemic has forced most countries to institute a shutdown of their economic activity at enormous local and global cost. Dr. Ismail Seradeldin, given your expertise as Vice President of the World Bank, do you see in this feasible and realistic opportunity to design bespoke stimulus packages that can also help the poor internationally and move us towards more sustainable development strategy?
Well, I'm very glad that you are raising this question, Mr. Chairman, because actually it is an important opportunity to think about this. The reason I say that is because of the magnitude of the impacts that we are witnessing. The numbers are almost beyond belief. If you think about what's happened in the United States in the last few months, we have had almost 40 million Americans losing their jobs. We've had a very large number of them, in fact, going on unemployment as a result of the lockdown. And the stimulus package was over $3 trillion. $3 trillion. I mean, these are numbers that dwarf any expectation that any of us could have had for spending on any programs that you could think of for the poor or otherwise. Unfortunately, the design of these programs have not been very good. Yes, people said we had to act very quickly, and therefore, you know, get the money through the door quickly to try to keep people afloat. But the net result of that is that you have a huge number of people who are queuing up at food banks in America. In America, they're queuing up at food banks like we used to see during the Great Depression of the 1930s. So the design of the stimulus packages, whether in America or in Europe, can be designed much better than I think they are, in order not only to try to maintain the status quo, but in fact to anticipate the changes that will come, and as a result to reach out and include in the decision making, include in the beneficiaries people who are currently being marginalized by these systems and people who are not sufficiently there. Now, having said that, we are here in a global session. And in a global session, we have a major problem that many of the developing countries, the poorest countries, don't even have the basic infrastructure to cope with the COVID-19 pandemic, on top of which there will be disruptions in the supply chains for food. And on top of that, and this is something that global leadership is required, absolutely required for, there is a huge debt repayment structure that is built in, where these poorest countries are supposed to pay back debt that they on previous development loans that they've received, at least 44 billion out of sub-Saharan Africa alone. So you're looking at a very big problem, and just postponing it by 6 months, that is not real leadership. What we need is imaginative leadership that will, and here the academia can provide ideas and models and instruments. For example, the Arrow Debré, Kenneth Arrow and Gerard Debré are both Nobel laureates in economics, designed instruments that could be of interest right now. People like Joseph Stiglitz, who's now back in the academic world, and others have ideas about how we can, in fact, restructure that without having all this money passed on, staying in the banks, sloshing around, resulting in greater volatility in the stock market, but not benefiting the poor. So how do you design that? Here is where the best minds in the academic world can come to help. That's what great minds in the academic world, like John Maynard Keynes in the last century, when he said governments have to step in. The business cycle is not foregone. We have to change. And he saw and foresaw that that's what we need right now, imaginative proposals to come in, or else we'll be just pushing in front of us a huge set of problems that will undermine the 2030 agenda, the Sustainable Development Agenda, will bring back a new debt crisis, and will push back a number, hundreds of millions of people back into extreme poverty. So that challenge is a challenge for the intellectuals of the world. And I think that we are happy that the World Academy of Arts and Sciences and the NGIC are working on these kinds of issues.
Thank you. We already have some comments.
Thank you, President Constantinescu. We already have related to Dr. Serageldin's comments, we have some ideas brought up by the attendees who are looking at this debate, and all of the opinions brought together so far focus on the fact on what you already pointed, that we need to be innovative in the manner in which we need to tackle economics from now on, because the crisis pointed out that we are insufficiently prepared. That is one of the comments already brought to our attention on this webinar's chat. The fact that the crisis requires a way to lead globally, which is still possible even right now as we're still in mid-crisis and post-crisis, in order to be able to deal with the future crisis, and also in order to ensure that future crises, should they also occur, one of the comments brought to our attention by Yehuda Kahane says that we need to work on that because if 2/3 of the workers were still employed dealing with this pandemic, the economic harm would have been reduced, the injury to production workers and students would have been minimal. So thank you again, Dr. Serageldin, for pointing out the need of innovation, the need of innovative thinking in an economic perspective in order to deal with this situation. I give the floor back to President Constantinescu and to the other panelists. Thank you.
Healthcare is a key concern for the SDGs, and the COVID-19 pandemic has demonstrated that even the most effective healthcare system are powerless before a new and unknown enemy. Dr. Luisa Spiro, given the pandemic has shown a spotlight on the vulnerability of the elderly, how must we rethink our impression of longevity in this context, speaking both of our chronological and biological age? What is your impression of assistive technologies for independent aging, and what are the opportunities and challenges they entail?
President, and good evening to all your guests, and congratulations for this magnificent event. Thank you for the opportunity of speaking among your guests about health, about new concepts, about what is the vulnerable population during this pandemia and post-pandemia, let's see, and what is the relation with longevity. First of all, we do not speak about elderly population, because we do not use during the last years these words, because a society, as you know, is measured by how it cares for its older citizens. This is a statement declared by the World Organization in 2019. Regarding then about the COVID pandemic, 19, that has been accentuated the exclusion and of the older adults, as we call them. We call them older adults, and not only seniors or elderly population. And this current crisis highlights a disturbing public discourse about the aging. And there are so many questions about the value of the older adults' lives, and disregards their valuable contribution for the society. Meanwhile, you are asking about longevity, and how longevity can is influenced about this pandemic. As probably some of you knows, that there is a very famous study published in 2019, in early 2019, about longevity and about the main pillars of it. And these pillars are mentioning the most important criteria for longevity, actually. The first one is the brain health. The second one is a good diet. The third one is the physical activity. And the fourth one is the spiritual life. And here we can talk a lot about what longevity means, in fact. And when we speak about longevity, I think I have a fluctuation for my internet. I don't know if there is. Do you hear me? Do you
yes,
hear me?
We can hear you very well. Please continue.
Okay, sorry. Okay. So when we speak about longevity, this is a very important. This is a very, very important thing. During this pandemic, we had so many problems and misinterpretations of COVID-19 as an older adult problem, which is something very unpleasant, because many countries have chosen to impose stricter restrictions over the older adults, ordering them to remain inside during the pandemic. All these restrictions were exacerbating the long-standing problem of the older adults' isolation. And while restrictions may aim to be protective, such policies have often translated into patronizing public communication, depicting all other adults and vulnerable members of the society. What I would like to highlight is that, as you know for sure today, the younger adults are not immune to this virus, and they share the responsibility for the spread of the virus. We have to understand, all the society have to understand that, because some of us can become vectors for the older adults. But COVID-19 is also not a disease only of the elder adults, and its effects will be felt by everyone. And we all must do our part to curtail its spread. I will speak later about this, if I will have the opportunity, about the ageism. But I would also like to mention that, as you know probably, the older adults population all over the world actually is about 700 million. In 2050, it will be about 1.5 billion. And don't forget that the older adults over 65 and over will be much more in the Eastern and Southeastern Asia. And this largest increase is also a very huge problem for the global policies. And these policies in the area, of course, include those aimed at eliminating age barriers. So we do not believe in age barriers. And when we speak about biological and chronological age, this is a strong barrier in our days, because us as professionals, we do not believe in the chronological age, but mainly in the molecular and biological age, and also strongly believe in the financial age. And investing in education and health and well-being for all, in lifelong learning, in technology, as we do a lot since the last 15 years, we can improve the quality and independent living of the older adults. There is a need of more emphasis to be placed also in this lifelong learning to keep us with changing in technology and maintain flexibility in all the older adult skills. It's very important when we speak about longevity to include technology as part of this research. And I cannot imagine today longevity and the brain health without the use of technology and innovation solution to promote lifelong and independent lifelong learning.
Okay. Yes, uitați.
Dr. Seradelgin, did you want to say something?
Yes, Mr. Chairman, I would like very much to follow up on what Luisa was saying. We have a problem that we inherited from the 1930s of the last century. And this is primarily that with enormous success, we have extended life expectancy at birth by easily more than 20 years. So the net result is that a lot of the instruments that we had designed, including Social Security, including the notion that people would retire at age 60 or age 62 or maximum age 65, is no longer valid. People used to retire at those ages and die 3, 4, 5 years later. Now they live 20, 30 years more, and they are potentially very useful members of society. So I think that there is a real need to redesign not just the access to health services, not just the issues of whether nursing homes, isolations, etc., are valid or not, but the entire structure. Practically every country in the West today has a bankrupt system of Social Security, in the sense that it was designed on young people coming in because the population pyramid was like that. So more young people were coming in, and they were paying into it as they were in the productive years. And a much smaller part would be the retirees who would draw on that. That is no longer valid. It's an opportunity to rethink the role of the elderly in society. It is, as you mentioned, lifelong learning, a lot of other things can be brought in. And they can be brought in, and this time it can be brought in with the incentive that it will be economically viable solutions. We are designing economically more viable solutions than what we now have. So it's not a matter of just spending. It's a matter, in fact, of giving these people, the elderly, a productive role in society to the extent that we can match their abilities and their requirements and their desirabilities. That kind of thinking will come, Mr. President, it will come from academia, it will not come from elsewhere. The design of financial instruments will also come from academia. I mentioned the Arrow de Breu securities as one of the examples, but there are many others. And the fine-tuning of these instruments, I think, are very important. Finally, I'll just raise one question to leave with you. Right now, we also need to rethink globalization in terms of what it means in terms of trade, because the old-fashioned trade is now being challenged again as a result of the bad experience that people have had suddenly of finding that they can't produce something here because a piece of it is being produced in another country and it's not available, whether it was for masks or for other things in America and so on. So I think we need to see how we can seize the moment and have the academics come up with new ideas and new solutions that they can present to the decision makers. And Lazaro is right, sometimes they will reject all 5 proposals or all 10 proposals, but other times they may accept. And gradually, when I used to be at the World Bank, I always told my colleagues, a no is a yes that needs more work. So when the politicians say no, we have to come back again, fine-tune the proposals, and push forward the ideas that will reach out for our common humanity. Thank you.
From healthcare, we now turn to another critical field, education. Rector Remus Pricopie, where do you see universities' contribution in addressing the current COVID-19 crisis?
Good evening, everyone. Thank you, President Constantinescu, for inviting me to this debate. Very shortly, before to go directly to this topic of COVID and universities, and fortunately we have many good examples of involvement, I would like to add to the arguments of our colleagues already stated here, the role of academia and how I see, and my colleagues here in the university, we see the role of academia in implementing public policies and in designing new model of governance. As we very well know, politics is done by politicians and it's normal to be like this. It's a democratic way because they have the legitimacy of the citizens by votes. However, politicians have different objectives in terms of their mandate. A mandate of a politician is 4, 5, 6 years. It depends on the political system. And sometimes they are looking to see concrete results within their mandates, if possible tomorrow. I used to be Minister of Education, not as a politician. I was a specialist invited to sit in this political position for 2 years. And I know the kind of dialogue that a cabinet generally has. However, we have issues which we cannot address in 2 years, in 4 years. And for example, let's discuss about education challenges, kids left behind, curriculum, and integration of these graduates on the labor market. Sometimes you decide something today and will have an impact in 10 years, depending on the educational cycle and the years of study for specific pupils. So this is the role of academia to think beside the pressure of time and beside the pressure of votes, and to try to give solutions for the country and not for a specific political win in a political campaign. Also another aspect which I do believe we have to play a very important role is to try to translate in both directions, translate a specific topic, a specific policy to the politicians in order to persuade them to adopt specific measures, but also to translate the specific policy proposal to citizens, because our responsibility is not just to teach and to do research, to teach in front of our students. Sometimes we have to teach by doing public communication and to try to spread some concepts for the public good, not for other interests. And I do believe this example of COVID is a very good example of involvement of academia. If we are to count in Romania, for example, but also in other countries, the public speakers on COVID, you will find a lot of medical doctors, university professors doing their job in front of mass media and trying to send the message to educate the population how to avoid infection. And another, and now I'm coming directly to your question, we have many examples here in Romania, but also I am aware of other examples in other countries, and universities contributed with the identification of problem to understand exactly what's the risk, how this problem will develop in short, long, and long term. Also with medical analysis, for example, many universities in Romania, not necessarily medical university, including technical universities, use their equipment in order to identify the infected people based on a protocol developed in medical schools and in research institutes. So this happened, for example, in Suceava University, which is not a medical school, but working with a specialist, they were authorized to do this testing. Also, we can go further and say the university provided the basic research, fundamental research for the needed vaccine that, you know, everyone, every prime minister, president is looking for in order to go in front of the citizens saying, we succeeded. And again, we have many examples in, we have Oxford, we have a lot of many American universities, we have Cluj Medical School who is in this competition to have a vaccine. And also we have the prediction, because no one knows what's going to happen. And practically, and that it's good, it's a good moment, good example to show how politicians practically follow, I would say 90%, the advice of the specialists. In Romania, the president, the prime minister, the government, they said, based on the specialist opinion, we consider we have to do. So it's a very good example, even though the situation is bad. But I would like to see this very good example when, for example, the medical doctors and the specialists in psychology, they say, in order to have good results in education, let's start to follow the kid from the beginning when he's still not born. Let's monitor the mother. Let's monitor the health of the mother and of the kid. Let's start education at 1 year old. When I said as a Minister of Education, we have to put in the near future compulsory all kids at the age of 3 in kindergarten, many journalists started to criticize me saying this idea is not a good one. It was not my idea. It was based on research prepared by specialists in Romania, but also around the World Bank advice and many other sources, specialized sources. And I will conclude because President Constantinescu said, let's clarify the terms. So we use this term global governance. What does it mean? It depends of different people, but for me, it's clear it's not a unique cabinet ruling the world. This is not global governance. For me, if I am to try to define, it's more a coherent approach. All the time you will have local, national, regional, and global form of governance with different responsibilities. But what is important, and as a Minister of Education for 2 years, I tried and I think I succeeded to approach different challenges this way. Okay, we have this issue, kids left behind. Is Romania the only country having this issue? Naturally not. Okay, let's see what the other countries have done, how they approach this. Let's have a comparative view. And after that, when I go in front of the Prime Minister and in front of the public opinion saying, based on the comparative study with 103 countries, together with the World Bank, it's exactly my message at that moment, we put on the table the strategy to decrease the number of kids who are not able to succeed the school. So if you want to criticize, you can criticize me, but not for the idea, because all the ideas there are the ideas of dozens of specialists, Romanian and internationals. So this is a way to approach in a more, as I mentioned, coherent way, never mind the issue, never mind the policy. And politicians, and I'll conclude, they have from time to time to listen more than they can imagine, to listen from the specialists. I'll stop here. Thank you very much for the time.
We have now another comment from our viewers.
Thank you, President Constantinescu. Thank you, Rector Pricopie, for this comprehensive view on tackling education and connecting it to decision makers and the need to transfer education, health-related topics to decision makers and politicians to be able to elaborate strategies, long-term strategies that could identify problems and give the appropriate solutions. Going back to our main topic, the idea of the role of education, the role of academia. We have a question from Professor Rodica Toader. She's a mathematics professor at the University in Udine, and she would like to address this question. She would like you to address this question. During these months of lockdown, schools and universities moved online. So we had online education, as Professor Toader is writing. Do you think this will have an impact on education also after the pandemic? And should academia take advantage of this huge effort to promote a broader access to education? And if that is the case, how should it be done? Thank you.
Thank you for the interest and for the question. In my opinion, the answer is yes. We'll never have the same system of education like in January 2020. Many universities and even schools. In fact, yesterday the government put on the web for public consultation a new thinking of opening the schools in September, which will imply combining online and in the classroom classical education. It is what when I was a student in Institute of Education in London, I learned for the first time the concept blended learning. That was 20 years ago. And I didn't understand initially what does it mean, blended learning. So we'll do blended learning, including in my university in CNSPA, trying to heavily use the online instrument and the permanent connection with our students, and also the classical interventions. And related to resources, yes, education is also an issue related with resources, academic resources. There are many students, many pupils not having access to internet, not having access to a computer or to a tablet. In my opinion, and during this pandemic, we had different meetings, including with experts from UNESCO, UNICEF, World Bank, OECD, and I do believe soon the definition of compulsory education will be changed. And one of the conditions will be not just to have the pupil in the classroom, but also the pupil to have access to online resources, never mind where he or she is. Something which in Romania, somehow we started 8 years ago by introducing online textbooks. The first country, we don't say this unfortunately, but Romania was the first country putting all textbooks associated with a grade, at that moment the first grade, online with free access for everyone. So now we have more than 1 year. We have, I think, 6 or 7 years of studies with all textbooks there. And we have to do the next step to provide each kid with a device in order to can access these resources. So to be short, because I was not short in my response, I do believe the future will be a blended learning system, never mind the country, never mind the kind of institution.
Thank you, Rector Prikopie. Dr. Seradergin, do you want to add something?
Yes, I do. I want to speak specifically to this point that was raised. Yes, we will have a very different kind of educational system. It already had started. You know, MIT has had all its courses online for the last 10, 12 years now. Khan Academy has done a lot of shorter interventions. Coursera and other Udacity and other online learning from Stanford have had major impact. edX with Harvard and the Texas A&M and so on. So we have a lot of examples there of things that are happening, but they will be, I think, as the Rector Remus said, part of a blended system. Education is not the education that we think of in terms of 12 years of school or 2 years of kindergarten, 12 years of school, and then 4 or 5 years of university, is not just about imparting skills. It is also very much about socialization. It is how it's unhealthy for children to be devoid from contact with other children, each one staying home and connecting with online and so on. But we can use online much more creatively than it has been used in the past. But children need to be with other children of their own age. That's part of the socialization process. And especially in universities, from the end of high school to the end of university, this is when young or growing children become independent citizens. This is where they experiment with their own health, with forming households, with entering the labor market, with a lot of transformations, profound transformations that take place in every society. And the community that exists in a university allows them to experiment politically and otherwise until they come out as responsible citizens on the other side. So that function there will have to be found in a different way, I think, than it has been in the past. But I don't think that you will totally replace it with what we now have, as some people imagine, which is people staying at home and trying to do everything online. We will do a lot more online, as in fact in meetings. I suspect that the future of meetings will be, as we are doing right now, a lot more of this and a lot less of the old-fashioned way of, which I used to love, of going to meet people and where we would go out for a cup of coffee and sit down for a lunch here and so on in the meetings themselves. But this is so convenient because you can pull people from all over the world for 2 hours and get a good interaction among them. And I think that that will also evolve on the other side. But please, let's not forget the socialization function of the school system and of the education system, not just the impartation of skills.
Thank you, Dr. Seradergin. Dr. Spiro, do you want to say something?
Unmute, unmute. Yeah. Unmute, please. Unmute, unmute.
I fully agree with what you said, and don't forget that during this period we faced many problems with the social distance. And don't forget that one of the most important pillars for longevity is socializing. And I fully agree, as an educator, as a professor of medicine, and also dealing so much with technology the last 16 years and working with technology, how to decrease and how to delay the cognitive decline of older adults. I had to understand a lot of things regarding stress and anxiety and depression during this pandemic. month. So, and regarding the students, of course, the digital world is a very, very useful one, because also medicine is very dynamic in the field of artificial intelligence and using technology. We know all of that, and we are hardly working on that. And but it's true that socialization and respecting these 4 pillars that I've been talking before about longevity is essential for our health and for our independent living. Thank you.
Thank you. Going back to the topic of sustainable development. Dr. Borbély, could you tell us how decision-making factors can constitute a catalyst for sustainable development? What has been done until now at the state level to achieve the United Nations Sustainable Development Goals?
Yes, just a short comment regarding the topic of education and how we prepare ourselves for the future. Based on my experience, we have to, and somebody mentioned from the panelists, we have to start from kindergarten, in my opinion. And of course, from at home, to have a very clear position regarding these basic principles. And regarding the partnership between the governments and education and other stakeholders, we have a very fruitful discussion with the Ministry of Education, and we will have not a new curricula, because we know very well about the Romanian curricula, how big is, and it's not relevant to have a new curricula. But we will have some specialized materials from kindergarten until universities in a half a year. And it's very important to have this holistic approach, this principial approach of what means sustainable development. That's why it's a basic document of this century, in my opinion, the Agenda 2030. Because for the first time, we have data, we have indicators, and we can put together these indicators to have, based on analysts, based on specialized people, to put on the table of the politicians what has to be done in different areas. And I am very glad that Minister and Mr. Rector Pricopi is here, because I will tell him probably a very well-known issue. When I started here with this department, I saw a banner here regarding an important project I realized, coordinated by the Secretary General of the government and Mr. Professor University, State of Nation. It's a platform with 113 indicators, which was a very important project for 3 years. And now we ask from the colleagues to put together our background documents and the State of Nation, which is now here at the Secretary General of the government, to put together and to look which are the basic indicators, maybe to change some indicators, but regarding the platform that we will have in 1 year, not just for Romania, but for 4 years in this area, will be a very important tool in the hands of all the specialists. We will have all the documents regarding sustainable development, all the reports. Unfortunately, Mr. Jeffrey Sachs is not here, but he has a dashboard in each year with 160 countries, in which stage they are regarding the fulfillment of the indicators of basic regarding education, regarding health. So in my opinion, to come back to the question of Mr. President Constantinescu, it's crucial to have a dialogue and to have a very clear interinstitutional framework, not just for a webinar, not just for, and we have this protocol signed 1 or 2 weeks ago with Mr. President Constantinescu Institute for Levant and Romanian government. And we will have, I hope, many different, very important this kind of meetings, not just online. And for the last, my comment, I am very, you know, linked to this Rubik Cube. You know this Rubik Cube, yes? This Rubik Cube, it's with the 17, we write the 17 SDGs. And if you turn just for 2, you know, very small movement, it's not functioning because some pieces, they are not in their place. So this is like our society. If we have no each part, if each piece of the society, health, education, infrastructure, and other issues in her places, will not function or will be a less functionable society. We have to put together, but we need all on the board. And that's why it's important to have this kind of meetings and to look how we can put together the experience of one university, of those institutions who can help us to know more about our society for the future generations. Thank you.
Thank you, Dr. Borbély. Thank you for bringing up the idea of dialogue between institutions and the idea of creating an interinstitutional platform. Dialogue is very important in order to achieve something, because that's the end goal of any dialogue, to reach some sort of resolution. And we have another question from our attendees, which is focusing especially on what you have put out so far, the idea of creating this dialogue to bring together all the pieces of the Rubik Cube, all the pieces of the 17 SDGs. And the question that is addressed to you, what would be the best way to persuade decision makers and policy makers who are also playing in the most critical and shareholder section, because this is important in order to achieve inclusiveness?
It is a very difficult question. Based on my experience, during these 3 years, we have organized about, I don't know, more than 150 meetings. And not just apropos about online. I hope that we will have also physical contacts and meetings, not just online. It's very good to stay at home and to have this kind of meetings, but I like to see the eyes of those who are partners and to explain to them how important are to feel each other, to have this positive energy, which is more difficult in online. But basically, regarding the dialogue, now we have a data network of more than 2,500 people from different areas. And we have a newsletter. In each month we communicate them, which are the main purpose and how they can help us. We want to collect their opinions, but very important is how the institutions will answer. So that's why we established so-called hubs in each ministry, not on the level of politicians, because the politicians, you know, Secretary of State's ministers, they are for 4 years or less, because I am now the 4th prime minister in 4 years, and each of prime minister during this period give me a green light. It's very interesting. It's a consensus now. It's very difficult to have a consensus on the political life of Romanian society, but it was a consensus regarding the issue of implementation of Agenda 2030. We have to continue on this. And that's why we established this dialogue. We will have an action plan. In a couple of months, we will finalize an action plan regarding all the 17 SDGs. We will have this consultative council, as I mentioned earlier, with 34 important personalities in Romania who are involved on this Agenda 2030. We will have different committees, and I hope that they will be workable, so not just to meet each other and to nothing happens on the future. So yes, it's very difficult to have this kind of dialogue, but we need a position of this department near the Prime Minister's office to be a catalyst, to be catalyst of different issues, to ask ministers to come to the same table and discuss issues, and of course to have credibility and regional performances. Thank you.
Thank you, Dr. Vorbeli. Dr. Seradelgi, the theme of globalization took center stage from the outset of the pandemic. We have entered an age of globalization and trade, but there are many voices now wanting to roll back this development. Why is that?
Well, the economists will tell you that trade is beneficial for everybody, but that is not quite true. It is beneficial, yes, and there are winners and losers in every society. But what they meant was that, in fact, the amount of the positive gains in that society is enough to compensate the losers. But that has not happened. In fact, if you look over the last 35 to 40 years, we have had more and more people left behind. We have had more and more people who are at the bottom of the barrel. So in the US, for example, if you look from 1980 till 2020, you will see that the bottom 50% of the country used to receive 20% of the income. Now they receive around 10 to 11%, while the top 1% of the country used to receive 10% in 1980 and now receive over 20% of the total income. So that the top 1% is more than twice the bottom 50% of the country. So yes, they could have compensated the losers, but they didn't. So there was a major reaction in most of the countries of the West, and we have seen the rise of what we refer to vaguely as populism and nationalism and so on. But the last aspect of the COVID pandemic has shown also that the integrated supply lines, the just-in-time management that we used to talk about in the 1980s and 90s, has resulted that all of a sudden, even countries as well advanced as the United States cannot get certain types of medical instruments because parts of it are being done in China and parts are being done in Vietnam and parts are being done somewhere else. And all of a sudden you're getting this kind of return to a nationalism saying, make it here inside the boundaries of my country. So three separate problems. Problem number one, those who were left behind and who incidentally have been among the primary voters of Mr. Trump in 2016, that he was able to tell them, you have been forgotten, I will not forget you. That was one group. Second group is a fear of the dilution of the production systems and the desire to have a greater buffer stocks inside the countries themselves. And the third group that is also anti-globalization has been a tremendous concern about the fact that the most powerful countries are going to dilute the cultural identities of various countries that are smaller countries, and that you will lose some of that in their inability to manifest themselves. So all of these are posing questions. But we also have something totally new, which is technology is creating new kinds of globalization. So globalization is not just like the Kennedy round and the Uruguay round and the unsuccessful Doha round, where the WTO members all negotiate for years and then sign agreements for all the countries. That's one type of trade negotiations that used to exist. We now have new realities created by the companies themselves, who have supply lines that are spread throughout the world, and who they have created some kind of a bottom-up type of globalization by connecting with suppliers from all over the world and with distributors all over the world as well. I mean, it's kind of interesting that Apple produces mostly in China and sells a lot in China, as well as a time when there is all these tariff battles going on. So I think that we need to revisit the notion of globalization and trade, and to look at how technology, and that's a huge topic in and of itself, but how technology is enabling us, partly through ICT and communication, but also through everything from the spread of seeds and varieties of food. I mean, now there's hardly any food that you cannot find in a supermarket, regardless of the season that you are in. So there are all sorts of different kinds of things, transport, communications, etc., where the technology is also making a new kind of globalization. Now, can we, in fact, say, let us recognize our common humanity? I mean, after all, the United Nations was formed, we the peoples of the United Nations. It doesn't say we the nations, it says we the peoples. And the Charter therefore recognizes our common humanity. Can we go for an inclusion of the poorest of the world along with us in a sustainable development pattern? Because we now learned, whether it is from the pandemic or from climate change, that what happens in one part of the planet is impacting on other parts of the planet, and we need to work together. That imaginative new proposal, it's a new form of multilateralism that we need to reinvent for the 21st century.
Thank you, Dr. Seradeddin. In spite of debates surrounding globalization usefulness, it has also accelerated the development of new technology. And today, technology is omnipresent, and they're, I say, indispensable to any field, especially to healthcare. Dr. Spiro, at the Anna Slan International Academy, you are undertaking pioneering work in the field of gerontotechnology and science in order to develop a process of active and independent aging. How do these efforts correlate with the broader picture of sustainable development our societies?
Thank you, Mr. President. I'm very happy that you launched this debate during this meeting. As a researcher, but a medical doctor as well, I've been created the Anna Slan International Academy Foundation in the early 2000s, and continuously for 20 years, I'm coordinating European projects, and beginning with the early 2004, we have been launched, and we developed and we have been beginning to test and working in multidisciplinary teams, innovative solutions for the older adults, as we call now. It's true that in the very beginning it was quite difficult, because being a medical doctor working in this field, it's not very easy to deal with technology and with let's say engineers, specialists in IT or artificial intelligence, and this is what we do right now. And during all these years, we made a great progress in testing and designing also the profile of the end user, of the older adult profile for these new technologies. In fact, we've been presented almost every year in the European forums, our experience, because today we are considered to be top 5 in Europe among the most important organizations, medical organizations, making research in this field. And speaking about using technology and trying to delay pathological aging, and especially pathological brain aging, by delaying the cognitive decline, which is our specialty, because we own an excellence center for Romania in the field of memory diseases and longevity medicine under the auspices of the European Alzheimer's disease. I don't think that this is something very easy to be done. On contrary, working in a multidisciplinary team and going step by step by trying in the last, let's say, 7 years to use technology, especially for the independent living older adults, so living at home, it was not very easy. So we can share today our experience, and we are doing, as I said before, almost every 2 years in the European Commission, and at the top management of the European Commission for the Innovative Solutions. And some of these conclusions are based on how you organize this work. First of all, being an expert organization, we were very many times asked, why are we successful? First of all, because we have a multi-medical, multidisciplinary team. And then we respect the methodological guidelines, and we create new guidelines adapted according to the European standards. And we also develop this European standards almost every 4 years. We have a long history of training and certification as an organization for integrated education. We've been trained more than 5,000 doctors and even equal nurses. We have the access to a huge database of thousands of patients and caregivers and hospital centers. But how we succeeded to apply our expertise in this technological project, in using technology, not only in assisted ambient living projects, but assisted and creating and also designing the profile of the end user for these technologies. Because we used to use adequate assessment tests. We always quantify the benefit of technology by measuring the improvement in scores. Then we implemented the educational stereotype of learning through repetition with the older adults, which is essential. And we succeeded to secure permanent assistance dedicated to the resource contact point. There is a paradigm that we would hardly trying to remove from the old adult end user, that they are testing, not them are being tested, which is essential. If you want to be successful, you have to persuade an old adult to test technology and not to give him the feeling that it's tested. And not finally, we are very much based on preventive, for pre-medicine, which is prevention, prediction, personalized, and participation medicine. And sharing all this expertise for the last, let's say, 16 years, it's not the last to involve stakeholders in this process of defining the requirements of the older adults who test this the technology. Also, we dedicated events for the attraction and the recruitment of primary end user or secondary end users. And this is how we succeeded to create a very strong network between the patients' organization all over Europe and also internationally now, because I'm very proud to say and to mention that among the 22 European successful projects in the field of using technology, we also coordinate two very large projects, European projects in the field of elaborating new guidelines for using technology indoor and outdoors, and this is essential. And not at least, but not the last. There are very many challenges. Some of you are experts in trading and in finance, and we've got many times the question about why these products are not always on the market, are not so visible on the market. And the problem is that the mentality of developing and selling these kind of products is not yet approved and understood correctly, including as a business model for those who are putting this on the market. And this is essential for this kind of products. But I think because we are here to debate the new sustainable development, the global sustainable development for the next 10 years, I think that this is one of the most important challenges for companies, for investors, for startups to invest in this kind of products, because I'm sorry for that, but we cannot separate today modern medicine from technology and artificial intelligence. Again, I think regarding the technology, this is our experience, and I'm very happy to share with you. And we also coordinate one of the largest projects right now in Romania, and we are setting up 1,000 homes, apartments in Bucharest and Ilfov with technology. And the role of it, the project name is Smart Bear, and the role of it is to get informations without any effort from the independent older adults, to collect clinical information about the diabetes level, the heart rate, the acoustic problems, the cognitive disorders, the frailty, the risk of falling, and so on. So it's very challenging, but it's wonderful to work with technology in this very modern era. So this is our experience, and I'm very happy to share it with you.
Thank you, Dr. Spiro. That is a very impressive work that you're doing at the Academy, and all this intertwining between technology, individuals, medicine, education, training the trainers, because you said, you mentioned the idea of working and training professionals. And our viewers are particularly interested in what you are doing. And we have a question regarding the connection between technology and the individual, because you've been speaking about this through the programs that you are pioneering at the Naslan International Academy. And our question focuses on the fact that technology is crossing borders, even during pandemic. But however, during the pandemic, we've had a major issue because borders were closed except for essential goods. However, April Ripley, who is asking the question, is stating that essential goods are also, shouldn't be human beings also considered essential goods? Then how should we deal with the need to connect technology and human beings during the during a pandemic in this context of closed borders? How did you deal with the idea of closed borders? Because I'm sure you have foreign partners and you have associates, professionals, foreign professionals working together in the projects that you're developing. How did you cope with this situation, focusing on technology, focusing on artificial intelligence, the ones that you are using, and last but not least, and probably the most important, focusing on the very individuals that you're both approaching from a professional side and also from the target side, the people that you're trying to work with, cure, produce medicine and so on, and provide strategies for their for helping them.
It is true. It is. First of all, I'm a clinician, so I'm a professor of medicine, and I'm a practitioner. I'm not only a researcher. So I'm a researcher, a practitioner, and also a trainer and an educator. During the pandemic, it was quite difficult because we had many serious problems regarding our older adults. First of all, were our patients, our outpatients, who were continuously asking for advices and who were not able to reach the hospitals because most of the hospitals were blocked because of the emergencies regarding the COVID-19. The second segment was about our inpatients who were at home or they have been sent to residential houses. And the third category were older adults who never have been our patients, in or outpatients, and who are continuing. And during this period, we have been asked many questions, emails, phone calls about what they should do during the pandemic. This is why during the pandemic, I accepted to have a twice a week direct TV program and to meet the questions and answer direct of all the persons who saw me. And I always had an invited a guest from my team to debate all their problems. And I have to tell you now, after 2 months and a half, that the most important questions regarding that isolation time were related to anxiety, to the lack of privilege, sitting with the family. Question related to diabetes, to oscillation of the blood pressure, so cardiovascular risk problems. But most of all, it was the isolation, the social isolation, which was really a problem. So if I have to quantify now how many questions were about anxiety, depression, more than 85% were related to that. So it was a huge experience because during these sessions, direct session that I've been asked to do, we had more than 60,000 visioners or active people reaching this meetings, weekly meetings. Regarding the technology, it was very useful because without technology, we couldn't have this dialogue. Most of them, they were trained by their family. Some of them were our volunteers. Some of them were our patients or our inpatients, outpatients. But the most important is the use of technology during this pandemic time. And they were very happy, and some of them discovered for the first time the use of technology. And don't forget that, as I told you before, we are used to work with technology for at least 16 years and to test technology and to design the profile of the end user of new technologies. So I think without technology today, we feel this social isolation much deeper if we didn't have access to it. And that doesn't mean that technology should replace what is essential in our life. I mean, social living, spirituality, let's say, tradition, exchange of opinion, all these kind of very important things which are essential also for longevity. So from my point of view now, because we are working the last 2 years to develop artificial intelligence solutions for prevention, because this is where artificial intelligence is useful in medicine, and not only, it's to have as many tools to prevent and to have early reactions before the disease appears. In fact, this is the state of the art in medicine. The early intervention before the disease is set on. So fortunately, we have to give technology the recognition it's needed, but also to understand that without the expertise of setting up all this information and putting them together into a holistic way, as Professor Barberis says before, it's essential, because we need to train more and more doctors in a very holistic and integrative way in order to understand what longevity is and how important it is to have early interventions after 40, after the age of 40. This is if we speak idealistically about this. So as soon as we can do things, this is very, very welcome. There is no secret. In fact, there is no pill for longevity. Everything is based on prevention, education, knowledge, interest, participation, and a lot of research and implication in this kind of, and of course vocation, because medicine without vocation, it's not so spectacular as we would like to.
Thank you, Dr. Spyrou. Dr. Seradelji.
Yes, thank you. I wanted to pick up on what Dr. Spyrou said, because research and medical research particularly is extremely important right now. And specifically that there's enormous variability between countries around the world. Yes, we have a common enemy in the coronavirus and the COVID-19, but nevertheless, there's each country has its own specificities in terms of family structures, in terms of deployment of urban and rural environments, etc., and the quality of healthcare as well. So in fact, a number of us are involved with the European Center for Molecular Biology and Dr. Charles Offray and others. We are making proposal. In fact, it's being hopefully published in the Lancet, maybe in the coming issue, where we need to make sure that there are a series of studies that will look at the genotypical and phenotypical aspects related to the patient pool under the same protocols. And if we can have systematic agreement beforehand with everybody doing the studies that they are doing on their populations or subsets of their populations, samples, sample size, and everything that we can agree on, and the protocols and the prior consent and so on, then we can have a much better chance of comparing and understanding the information that is coming out, and the data and the methodology will be better understood. Because we have had a couple of months in these last 6 months where data was coming and going from all over the world, and nobody could really compare this with that. And so the ability of saying, let us at least, we're here for the long haul, can we perhaps not necessarily collaborate, let each country do its own piece, but let us have more or less certain minimum standards that can be applied. Then you will have a capacity for institutions like WHO or others to participate in pulling together that data sets, which becomes much bigger data sets, and where we can in fact look for variability as well as commonalities, and open a new chance for another round of scientific research that will hopefully help us developing better technologies as well. Thank you.
Thank you. In order to create effective healthcare and educational system, we must integrate them in a developmental model. Dr.
Yes.
Seraderji, what is the prevalent model for development today in advanced countries in relation to that of the developing world? Should these models overlap, integrate, or separate altogether?
Oh, well, that, Mr. President, you have hit one of the biggest and most profound questions that we have today. I think we would all agree that the notion of one size fits all, that you have a single model and that it applies to everybody is not the right way to go, because every society is different. Its challenges are different, both in terms of the natural challenges, the environment in which people live, the kinds of cities, etc., etc. Everything is very different. But at the same time, we can share the same goals. And that's why we have the Sustainable Development Goals. Yes, we want to reduce inequality. How much, where is going to happen is going to be different in every country, but we have a number of indicators. So the 17 Sustainable Development Goals, we have 160 plus indicators which are grouped in different ways. And we have different dashboards to look at each country and to look at all these goals together and separately. And I think that the development models that we'll have are very different. Now, right now, we are caught in a particular situation. The rich countries, and primarily the richest countries, the United States, Europe, I'm thinking of the Eurozone in particular, the British with the sterling pound and the Japanese with the yen, in fact, have a situation where they can do quantitative easing or printing money. They can expand very significantly the availability of credit to their citizens. And the scale of interventions, both in Europe and in the United States, where, I mean, it's over 3 trillion in one and almost 1.5, 2 trillion in the other, trillion dollars. You know, when you start saying, well, let's compare that, how does that compare to countries like Togo and Benin in West Africa, small countries, poor countries, etc., or even large countries, but still poor countries like Nigeria? You have a situation where I think the types of questions are very different. I would imagine that in the developing world, we absolutely need much greater government intervention, and we need it now, and we need it for a preventative as well as a proactive form, and that this is an opportunity, in fact, to expand the outreach. And we will hopefully have a vaccine, I hope. But even if we have treatments, we need testing, we need treatments, we need vaccines, and therefore a huge expansion of the healthcare outreach systems of healthcare, much as we will also need immediately a huge expansion of the agricultural research system, because the poorest countries that rely on rainfall are going to see huge variations in rainfall because of climate change. So you have 1 year flood, 1 year drought, that will have problems of availability of food. And that requires the intervention of government right now. These systems are not as well established in the poorest countries as they are in the rich countries. And I would think that we also need, and I would make an appeal right now, we must reduce, postpone, not just postpone, but actually significantly reduce the debt burden of the poorest countries. It is unthinkable that in the midst of everything that is going on right now, whether it is health or it is food security, countries like sub-Saharan Africa have to pay back to the rich countries of the world $44 billion. I mean, come on. This is not sensible. We are going towards another debt crisis. We saw several of those before, but I think, you know, why wait until we reach the cliff and start going over the cliff before we say, oh my God, we need to change the rules right now. Let us anticipate where we are going. Let us imagine and design together new approaches that can help these people help themselves in order to deal with health, food security, nutrition, essential aspects of that kind, as well as education, but that's another discussion as well.
Thank you. Turning to Rector Prikopie, I wondered what your thoughts were on the role of academic community plays in the process of shaping public policy. Do you think it should be more prominent, less, or is it currently at an adequate level?
Professor Constantinescu, I will answer with the words of the former president of Romania, President Constantinescu. When he was in the position of president, he invited academics to be part of the government, to take over different, very difficult positions, and based on their expertise and credibility as ministers, as prime minister, as politicians, to invite other academics and experts in their field to contribute to the development of Romania. Probably 24 years ago, when you decided to act this way, it was the moment when the future of Romania was shaped, the future of Romania as member of NATO and member of European Union. But besides this specific example, I would like to say the biggest policy ever in the history of the world, designed by academics and assumed by politicians, is Agenda 2030, Sustainable Development Goals. We all know very well the history of this process, which started before 2000 somehow. I would say it started in the 60s with different reports of academics, the Club of Rome, and so on. And this Sustainable Development Goals, 17, were designed by experts, by specialists, negotiated by diplomats, and approved by head of states and government. And related to this, I remember I was in some meetings, and a lot of people disappointed, university meetings, with the fact that education is not well represented in Sustainable Development Goals. And we have just higher education, especially, not education as generally. We have just one objective about equity and access in education, and higher education is not there. And I remember I asked for the floor and I said higher education is everywhere. Because if we speak about gender equity, if we speak about health, if we speak about as was mentioned, environment, any topic from Sustainable Development Goals, it's a topic which has the roots in higher education, and it will be implemented if experts and higher education and research institutes will contribute. And I'm very happy and grateful. Minister Borbeli mentioned a milestone project for our universities, the State of the Nation, which was initiated by the government through the Secretary General of the government. And I'm happy this project has outcomes which will help Romania to monitor and to reach these objectives in the near future. So the answer is yes. Academia has different ways of shaping policies, from simple public positions, you know, expressing their opinion as experts, to more complicated involvement, research, education activities, policy proposals, involved in the policy design process, because it is a difference between a proposal and the design process, assessment, and so on. In fact, is what in my university, which has a long name, National University of Political Studies and Public Administration, but a short acronym, CNSPA, is what the university where I have worked for the last 25 years has done since we were established. And again, Professor Constantinescu signed documents of the establishment of this university while he was rector at Bucharest University. And as you very well know, many today standard policies somehow were catalyzed in this university, like the law of access to public information, or the, we are speaking about public policies. The first master program in public policy was accredited in CNSPA. Gender issues, which is discussed today. We started with a master program on this topic in 1998. In fact, Mihaela Miroiu started this program. And many other evidence-based policies. Another topic developed during the years. And also, we are happy to go further with some examples from CNSPA. Many of the politicians are in, they graduated CNSPA, and you can see from their discourse, they practically have assumed different theories, and now they are trying to implement. And also, because it was discussed about transdisciplinarity, not just in this session, but also in other sessions, in our university, we are focused more on master program, postgraduate activities, and there are many people, many students who have already an excellent career. I'm looking at Dr. Spiru. Many medical doctors already established and not willing to change their profession as medical doctors. They come to us in order to acquire the policy skills or the managerial skills in order, you know, to better understand what a medical doctor can do in order to promote public health policies and so on. And this is not just in the sector of, so this transdisciplinary approach is present here.
Although our debate is drawing to a close, I am nevertheless eager to discuss the steps each of our respective fields might take in the future to facilitate the elaboration and implementation of global governance. Dr. Seradelghin, how will the pandemic and the emerging economy trends impact the design, development, and the distribution of global governance in the 21st century?
In the 21st century, Mr. President, is a long time horizon. I think that we have really three separate problems to look at. In the very short term, we have disruptive forces, both inside Europe and in the United States. In certain countries, there is or even in other countries as well, a return to authoritarianism, a return towards a vision of nationalistic populism that is not very conducive towards what is the second force that we are dealing with, which is how to strengthen multilateralism, where nobody dictates to everybody else, or one person can dictate, but rather where we can reach consensus through existing platforms, mechanisms, and institutions. That, after all, was the hope that we had in establishing the United Nations, where the individual state is still the basic building block of the international legal system. But nevertheless, there was an effort made to try to reach consensus. But the design was made reflecting the realities of 1945. The 5 Security Council veto countries were the victors of the Second World War. They do not reflect necessarily the reality of the world today. So we've tried to create new mechanisms from the G7 to the G20, and we've tried to find another way of bringing this consensus decision-making together. But we need to go back and redesign the system bottom-up. Because, as I mentioned earlier, on trade that was seen by everybody in the 80s and 90s to be something extremely beneficial to everybody, is now not seen to be that beneficial. And the fact that there is a disagreement on the priorities for implementation of some of our major things, like how much do you limit the action of pollution and so on as a result of industrialization and energy consumption, while at the same time recognizing the need for long-term sustainability. I believe that whether it's on the environmental side, whether it's on the trade side, whether it's on the multilateral side, technology will have a great deal to do, and science, of course, is what drives technology. And I'm going to make a very radical statement, but I am willing to defend it. And the radical statement is that every single benefit that has come to humanity in the last 400 years has come because of science. I mean, categorically, just think the hardship under which people were producing meager conditions to live in 300 years ago, and how all of that has been transformed is there. Science is advancing very rapidly. And science, incidentally, Mr. President, is setting the tone. The scientific community is the only fully unified global community. All the scientists of the world work together. Something goes on in Brazil, we know about it in Canada, we know about it in Romania, we know about it in Egypt. In a matter of days, we have inter-academy systems and networks that connect people together. We've been connecting the social sciences and the natural sciences. There is a system whereby doesn't matter who it is who puts it out, it's the content, not the person or their gender or their nationality or the God they choose to worship. Doesn't matter. What matters is the content. And look, we just had retractions from the Lancet and from the New England Journal of Medicine recently, because there is a systematic approach in science that enables this. So the scientific community is really setting the tone. It is setting the tone by showing the world we can have a common language, and we have a marvelous set of values that we want other people to adopt. Our number one value in science is truth. Anybody who fabricates data is rejected. The second value is honor. Anybody who plagiarizes other people is also rejected. The third value is creativity. We look for imaginative new solutions that change the paradigm. And there we have an engagement with the contrarian view and a willingness, and that's very important. We have a willingness to engage with the different view and a constructive subversiveness. We do not respect Newton less because Einstein changed our vision of matter and dimensions of space and time. We respect them both, and we anticipate the next transformation because that's how science advances. And above all, we have a system for arbitrating disputes, which is based on evidence and logical argument. Wouldn't it be wonderful if everybody else adopted the same principles?
For the remaining 10 minutes of this debate, I have some brief questions. Please answer in 3 minutes each. Dr. Spiro, in order to build global governance, we must above all remain in good health. How do we simultaneously manage both COVID-19 and ageism, having older adults on stage?
Yeah, it was during the last 2 months. Thank you, Mr. President. During the last 2 months, we've been faced a very difficult situation regarding the older adults who look like the sitting ducks, vulnerable and helpless against the pandemic. There were high mortality rates among the elderly, among the older adults, and that was considered as inevitable and normal, as a normal outcome of a pandemic. This is not only very true. Of course, we have to protect our older adults, but also healthy younger adults may perceive themselves as invulnerable to COVID-19. And it's true that you've seen how strong countries, industrialized countries like UK, like France, Italy, they had problems regarding this COVID problem with the old adults. It's true that we also noticed that during this entirely ageism period, the intergenerational solidarity, and this was a very huge plus, because despite this clear indication that we've noticed as geriatricians and gerontologists, were also encouraging signs of intergenerational solidarity during the pandemic. And there were so many hundreds of thousands of examples of younger people supporting older adults during the isolation. And all this led to few conclusions. And the conclusion is, first of all, is that ageism doesn't have anything with the COVID. It has to be a protective way for the older adults, but not an ageism attitude. And it's also, everything happened is a source of generational knowledge and wisdom, what happened in these 2 months and a half. And everything that happened can contribute to the workforce in increasing number, volunteers, and the strength of our economies and our families, in spite of all these difficulties during the pandemic. And we cannot afford to be careless. This is true about all these lost lives because the ageist attitudes. And I just want to highlight this because we need to consider what we stand to lose if we let ageism to influence how we discuss and treat the older adults. And for us, this is really essential because we care about every life, because this is why we are medical doctors. Thank you.
Dr. Borbély, how might your and similar other departments for sustainable development contribute to fostering a constructive relationship with the academic milieu in order to facilitate an open and transparent dialogue between governments and academic, both in the context of the COVID-19 pandemic and beyond?
We have already a very active partnership with the academic area, and Mr. Seregedin not mentioned a very important, and it was a brilliant speech of him, the last one, and not just the last one, solidarity. Yes, we need solidarity. Without solidarity, it will be not possible to solve the issue of COVID-19 and other issues. So we have a questionnaire of completed by all the universities of Romania. We have a new job in Romania, expert in sustainable development. Now we finalize to have a consultancy on this to prepare for the end of the year, how we will prepare this for this new job, expert on sustainable development, young people. We have an inventory of all the masterats and all the in universities in which stage they are. So, in my opinion, it will be very important to be together. But I see a very well-known friend of us, Mr. Jeffrey Sachs, here. He is with us, Mr. President Constantinescu.
Jeff.
Mr. Jeffrey Sachs.
Mr. President, thank you, Laszlo. And Mr. President, I apologize. I was battling entry into into the conference. I just didn't have the right password for a long time. So I know I'm at the very end, but I wanted to greet you and thank you for allowing me to participate and inviting me to participate.
The main
Thank you.
Thank you, Jeffrey. The main questions for you was, what are the institutional framework in which global governance can be applied?
Thank you very much. If I could answer that in a roundabout way, but briefly, starting with Ismail's also brilliant remarks about the norms and values of science. Unfortunately, the scientific community, as wonderful as is and as much as we subscribe to its values, doesn't have the full set of values that we need, which I would add mercy, justice, and the common good, which are not especially values of the scientific community. Not that they're antithetical in any way, but the norms of science, which are the seeking of truth, are not the same as the norms of the seeking of the good and well-being, which is really at the core of what we're after. I do believe that what we are witnessing in the differential response to this epidemic is partly the response to science and partly the values proposition. It is not a coincidence. I'm sad to say that America has 115,000 deaths and a psychopathic president. This is a values question. Trump does not care. He reflects a movement that does not care. Part of his constituency is exactly what Dr. Spiro was reacting to, actually literally saying it is the responsibility of old people to die so that young people can go about their daily lives. Stupid and hideous at the same time. So we really need to grapple with this values question. Many of the leaders in the world right now that are in runaway pandemic countries are leaders with profoundly flawed values and movements of very flawed values. I would put Trump on the top of this, but I would also put Bolsonaro, for example, as another case of a country with a runaway pandemic because of an ideology that is absolutely disturbing. And we need to face this. This is partly the pathologies of individuals that come to power, and it is partly the ideologies of greed that are pervasive and that need to be fought head on, actually. Thanks God, Romania is doing a vastly better job of controlling this pandemic, and I hope that and pray that you continue to be able to do so. We need the values that Ismail rightly championed of truth and of universality. we also need the basic value of compassion and the common good. And at the universal level, this is expressed in the moral charter of the United Nations, the Universal Declaration of Human Rights, the idea that every person on the planet has dignity and human value and human rights, including the right to life. And if something good comes out of this epidemic, and that could be the case, but it's not guaranteed, if something good comes out of this epidemic, it will be a return to the basic moral principles that there are universal values, that they are reflected in the Universal Declaration of Human Rights, that they are based on human dignity, and that they require the realization of rights that have been on the books now for 72 years, but not realized until today. And I think that this is the critical point from my point of view. Everywhere I'm speaking, I'm emphasizing the dangers of the United States right now as a country that does not have these values in hand in our power structure. But we need a global system that starts with the values. The UN was and is our best hope for that, but it absolutely needs renovation and strengthening right now.
Wonderful.
Dear Jeffrey, thank you for the insight. I have the last question for you. The 8 Millennium Development Goals, in existence since the year 2000, were replaced by the Sustainable Development Goals in 2015. The original 8 joined by another 9 for 17 objectives in total. The 2030 Agenda for Sustainable Development forecast, somewhat optimistically in my opinion, that the SDGs will have been achieved by 2030. Professor Jeffrey Sachs, given that the number of targets increased from 8 in 2000 to 17 in 2015, which only shows that instead of identifying more solutions, we are identifying more problems. Do you think that there is any change of progress of attenuating or diminishing the problems expressed by each Sustainable Development Goal in turn within the next 10 years?
Thank you for a wise comment and a good question. I think that what has happened, if we look historically, every generation, every decade, in fact, the UN has stated a new set of development goals. So the MDGs were preceded by decades of development that have been really the global commitments since the 1960s. Every case of them is about realizing what we promised in 1948, the Universal Declaration of Human Rights, because it's really all there. In the Universal Declaration, it says everybody on the planet has a right to health, has a right to food, has a right to life, social protection, education, and so forth. Then it says in that document that these will be progressively realized. We are 72 years later. They have not been realized, though they could have been realized vastly sooner. What is the problem? The problem, of course, is not only are these goals not enforceable in any meaningful sense, but the rich and the powerful countries of the world have never taken them all that seriously as an obligation of responsibility towards the poorer and the weaker countries of the world. Each succeeding instance of these goals, the problem became worse. I've been involved in this now for 40 years. The United States during that period went from the lead donor country to the greatest antagonist of the multilateral system during my career. It used to be a leader in development aid. Now Trump cancels support for WHO at the height of the pandemic. He even puts sanctions on the International Criminal Court. He withdraws from the Paris Climate Agreement. He withdraws from other international agreements, the Iran nuclear agreement. He puts unilateral sanctions on many countries that are crippling tens of millions of people. We became a rogue nation during this process. So we are not going to achieve the Sustainable Development Goals on the current trajectory. It's not even possible unless there was the will and responsibility to do this. And achieving these goals requires, first of all, goodwill. That means not fighting for power, but fighting for global solutions. This requires the powerful countries of the world to be working together, not to be creating a Cold War as the United States is trying to do with China right now, deliberately so, by the way. Not because China is provoking it, but because the United States is afraid of the rise of China's technological and economic capacity, so it's trying to stop it, which is an absurd idea, to try to stop 1/5 of humanity from having the benefits of modern technology. But that is what's going on. So what we need to learn from all of this is to absolutely press for honest responsibility among the powers of this planet. It's a hard and pretty thankless task, unfortunately, because they're not so prone to listen. But I believe that we need to speak very clearly right now, because we are in a grave danger on the planet, not only from the pandemic, but from the deliberate stirring of conflict, from the continuing nuclear arms race, the breaking of nuclear agreements, the environmental catastrophes. I hate to be so bleak about it, because all of these things are solvable if we, if Ismail's values of truth would be upheld, if the scientific values of truth would be upheld and combined with the values of decency, compassion, and the sense of the common good. In other words, strangely enough, we're not so far from achieving everything we've said we want to achieve. But to achieve it, we have to try. And we're not trying right now among, put it in the United States, we're not even trying to stay alive in the United States from a public point of view. They're ready to turn away from the thousands of deaths each week and not even care. That is our problem, Mr. President. How do we overcome this? You are a great leader. Please advise us on what the solution to this very real geopolitical reality is.
Thank you, Professor Sachs. We now have time for one last question. One necessary first step is to define the institutional framework of global governance. Rector Prikopiev, what role can schools of government, of political, international, administrative studies play in elaborating new models of governance in the 21st century? And what might such models look like?
May I start with somehow a joke? Sometimes we have a very bad role. If we look in mass media and read articles about our ideas, we conclude we are bad because we don't like the status quo, we don't like to sit for years in the same model, and we challenge the politicians, institutions, society to move forward. So sometimes, you know, our ideas, not just ideas that are developed in School of Governments, but generally ideas from universities. We have many examples in the history of civilization, how great ideas were criticized, were bad. I'm saying this because today in Romania, it is a big discussion about gender studies, if gender studies are good or bad. And 5 universities initially in the morning said the parliament cannot interdict, you know, to study topics like this. And after that, the National Council of Rectors issued a press release. So sometimes universities are considered bad, but besides this very specific situation, I think what we should value and encourage is a debate and it's a discussion, not just among academics. Sure, we, as Ismail said, the dialogue between academics probably is the most persistent dialogue through centuries. The first globalization was when universities started to develop and the academics and students to move around. So coming back and trying to answer shortly, I do believe if we say we have the answers, it's wrong. We don't have to claim this. What we have to claim is we think we have the good questions, and let's work together to find answers to these questions. And if we succeed to persuade all actors in the society and to work together to find answers, and after that to try to implement, I think we'll avoid many mistakes at the level of society. And I do appreciate, and from the beginning, I have supported the idea of Professor Constantinescu to organize within this conference of the World Academy of Art and Science specific sessions, this one the most important, with the role of academia in shaping the world. So congratulations, Professor Constantinescu, for having the idea and for being stubborn to push forward this idea and to transform the idea in this session.
Thank you very much. And I would like to thank everyone, including our viewers, for taking part in this panel. The ideas collected as part of this broad and brainstorming debate will be contained in a report that will be forwarded to the United Nations office in Geneva with a view to organizing an even more ample conference this fall. Its aim will be to collect the catalytic solution presented over the course of our many panels and to elaborate a series of programmatic documents to serve as a framework for implementing new policies across essential economic and social societal sectors at the global level. Thank you very much for your time, and I wish you a pleasant evening. Thank you.
Goodbye.
Bye, Jeff.
Bye-bye.
Bye.
Thanks.